learn to use plant-based nutrition as a primary intervention tool. And we've offered that for the last 3 years, and every year we have more and more joining the ranks of folks who will recommend the right things in order to help people regain their health. So I think we have a lot to look forward to in terms of overcoming some of the limitations that keep people from getting this message today. I think the big take-home message, and then I wanted to make sure I left time for questions because people usually have them, is that not only can you prevent disease, if you're sitting here and you're in a healthy state, you've got a great opportunity to reduce your risk of some bad things happening. But if you've already eaten your way into a problem, I love what Terry Mason, Dr. Terry Mason says in the movie. He says you can eat your way into cancer, heart disease, diabetes, arthritis, and all these common conditions, but you can eat your way out of them much of the time. One last comment I'll make, and then I'll take questions, is the question usually comes up, what about the role of genetics in all of this? And there's no question that genes are important. However, there's a difference between having a gene and genetic expression. And while everybody in this room is genetically predisposed to develop something or maybe several somethings, and I know that my genetic background on both sides of my family is frightening. It motivates me a lot to do the right things. You can avoid the expression of genes by changing your diet and lifestyle. I'll just give you one quick example. I am the first normal weight female on either side of my family. I've actually said this in the movie. If there's an obesity gene, I have it going on, but I've never had a weight problem, and the reason is that I don't eat the same way my mother, my sister, my grandmother, my aunts eat. Every woman on my mother's side of the family's had rheumatoid arthritis by the age of 50. I'm 55. I don't have it. Now, I will assure you that if I picked up my mother's eating habits, I'd be overweight and I'd have rheumatoid arthritis within a matter of a year or two. But I've changed my health outcomes by changing my habits. And we have lots of evidence to support this too, ranging from migration studies where people move from a culture in which healthier outcomes are to be expected to a country like the United States within one generation. The obesity and disease rates are the same. We have studies on identical twins. We have studies published by many of my colleagues where dietary intervention has been used as a tool for recovery, and what determines the outcome is compliance, not genetic history. So I always want to make sure I cover that, because if you go through life thinking that your health outcomes are a result of your genes, you're essentially a helpless victim. But if you know that it's the choices you make, then you get the power back. And I want people to feel empowered to really take control of their health rather than feeling that they're a victim of a poor genetic lottery. So with the time we have remaining, I'd be happy to answer some questions either about the film or any of the comments I made or any of the things we do at the Wellness Forum.